Okay, good morning, good afternoon, and good evening from wherever you are logged in. Welcome to this session on climate and water quality, building resilience through water safety planning. My name is Kizito Masinde. I'm currently the Director of Events and Awards at the International Water Association. I have for several years worked with the various utilities in Africa, guiding them in the development and implementation of climate resilient water safety planning. And I'm sure you all agree with me that this is a very important topic for discussion today. Next slide. Our agenda for today is, as you can see on the slide, we will have four presentations providing snapshots of experience on the topic from government, academia, and practitioners. And they are Katrina Charles from Oxford University, Muhammad Ibrahim from the government of Bangladesh, Kabindra Hudasaini from WaterAid Nepal, Michael Fisher from University of North Carolina, and Virginia Newton Lewis from WaterAid Sweden. We will then have an interactive session, a short one, before we move to the Q&A. And then we will conclude with a call for action. Next slide. And to introduce the topic, climate change impacts our ability to achieve SDG 6.1. It basically moves the goalposts and makes the challenge of reaching universal access to safely managed water and sanitation more difficult. It has an effect on existing water quality challenges by impacting the hydrological cycle. And so it leads to an increase in floods and droughts, therefore increasing risks of safe water supply contamination, seasonality changes, salinity intrusion, and other effects like sea level rise. We therefore need a shift in the way water quality is monitored and the way the data is responded to. Next slide. Therefore, as we track water safety through data, we need to question if we have the right data to support effective assurance of water safety. Climate change is exposing the mismatch between monitoring processes and water quality. In other words, the way we are currently monitoring water quality may mean we might miss the problem. The current approaches to monitoring water safety need to make these issues visible. Now, WHO and partners like the International Water Association have developed guidance to adapt to water safety plans to be climate resilient, but still many gaps remain in the approaches used and institutionalization in countries. Next slide. And so in this session, we have proposed a call for action, which centers on 3 points. The first one is on information, increasing risk-based monitoring of climate-related water safety issues to increase the visibility of the hazards. The second one is on investment, mainstreaming climate resilience in water safety planning at all scales. And the third one is on institutions, whereby we clarify roles and responsibilities to respond and act on water safety evidence. Next slide. We will now move to the next part of this session, where we will first hear snapshots of government, academia, and practitioners. And first of all, we will hear from Oxford University, the REACH program. And the speaker will be Katrina Charles. She is the REACH program co-director. And she will be giving a presentation based on Bangladesh. Welcome, Katrina. I think we are having a bit of a technical issue there. But yeah, now we have the presentation. Yeah.
two case studies from Bangladesh. Thanks, Casito. Thanks for having me here today. I'm really pleased to present some of our research about the impact of weather and climate on water safety. And in particular, I'm going to use two case studies from Bangladesh to highlight the impact of weather on fecal contamination within water and what that means for us in terms of managing water safety with climate change. So the first case study is an example. It's a longitudinal study done over 18 months at two locations in Bangladesh, one drought prone and one flood prone, that looked at E. coli in drinking water at the point of collection for 270 improved sources, piped water and tube wells, and at 912 households who were relying on those sources. And so from this data set, we're able to see the impact of weather on water quality. Some of the results are highlighted here. In the top graph, you can see the weather over the 18 months of the study, with the line showing maximum minimum temperature and the column showing rainfall. And so this study covered then the dry season, the cooler, drier season, and the monsoon period. And we see that these different seasons had different water quality. So in the point of collection in that second graph, the grey bars represent the proportion of the sources without E. coli present. So that first level is the low risk level without E. coli present. We see that there's variability between the seasons. In the dry season is when we had the best quality water, the most sources which were free from E. coli. In the wet season, we had fewer sources that were free from E. coli. And the difference was even more stark at the point of use. So we had the best quality drinking water towards the end of that dry season and the poorest quality at the middle of the wet season. And that's something we saw across the other side too. So again, you've got the climate at the top of the graph. We've capturing both the dry season and the monsoon. And we can see again in that the water quality results that the best water quality at the point of collection was in that dry season, with quite a big difference there between the best period and the worst period for water quality, and a similar relationship at the point of use. So these results highlight the challenges in terms of water safety with climate. But it's also important to think about what the implications are under climate change. And so one of the issues we've looked at with this study is the impact of extreme weather. And we saw that extreme weather is associated with worse water quality. Extreme rainfall events led to deterioration in water quality at the point of collection and the point of use. And this is something we saw across other countries as well. In Bangladesh, we saw that hotter weather was associated with worse water quality. As these extreme events become more common, this has implications for how we need to think about water safety and how we manage water safety. The second point from the analysis was that we could identify the indirect effects on water quality as well. So in particular in Bangladesh, we saw that weather impacted on behaviour, and in wet weather, people were more likely to clean containers, the local environment was cleaner, whereas in dry weather, people were more likely to store and treat water, spend money on water, and wash their hands properly. So these different behaviours change with the weather, and this also impacts on the water quality. It's important to note that we couldn't assess water quality at the period of greatest risk because floods made some of these sites inaccessible. And so that's always a challenge measuring water quality. And secondly, that the results that I've mentioned here were specific to Bangladesh, to these local climate conditions, and that it varied. People's responses, particularly their behaviour, varied depending on the local climate. The second example I wanted to highlight was the mix analysis, a nationally representative survey of water quality at the point of collection and point of use for 6,000 households done in 2019. And so across the survey, it demonstrates that access to wash in Bangladesh has improved between the previous mixed survey in 2012-13 and the most recent one in 2019, with big improvements, for example, for hand washing facilities and access to basic sanitation facilities. And so these we would expect to be associated with increases or improvements in drinking water quality. But that wasn't the case. When we look at the statistics, we see that the percentage of the population that had access to water free from fecal contamination went from 59% at the point of collection in 2012-13, only to a minor increase to 60% in 2019. At the point of use went from 38% to 18%. So we're not seeing the same level of improvement as we saw in other aspects of wash access. And in fact, we're seeing a decrease in water quality at the point of use. So why didn't water quality improve? So the issue here is that we're not considering weather in this basic comparison. If we consider weather, if we make that visible, then we see a different story. And so here the sampling was done between January and May. And so from the top graphs for rainfall and temperature, across those months, rainfall increased and temperature increased. And what we saw was differences in water quality, as we'd seen in the other study. So that water quality deteriorated at the point of collection here, and particularly at the point of use. So there was a big deterioration in water quality across those months. If we look at the month sampling was undertaken for mix 6 in 2019, that was later. It was delayed so that more samples were taken in that March to May period when rainfall and temperature is increasing. And as a result, you see worse water quality. If we compare just February only, so 1 month, what we see though is overall you're getting this improvement in water quality. So the proportion with fecal contamination in this graph declined quite dramatically at the point of collection. It was a big improvement. There was not such a big improvement at the point of use, but it has remained similar. It hasn't degraded. So what the data then highlights is that it's important to consider weather in water quality analyses, and that water safety monitoring has to consider climate hazards. For Bangladesh, I think it's important for them to think too about the climate resilience of these drinking water systems. So finally, in conclusion, weather and weather extremes impact on water quality at the source and the household in complex ways through changes in the environment and to changes in behaviour and how we manage water supplies. And secondly, water safety monitoring has to consider climate hazards using risk-based approaches to address data gaps and make the impact of climate hazards on water quality visible. Thanks very much.
Thank you very much, Katrina, for those two case studies from Bangladesh, looking at the impacts of extreme weather on water quality. The next presentation will be from Mr. Muhammad Ibrahim. He's the Additional Secretary, Local Government Division, and the presentation will be also from Government Bangladesh.
My first slide explains the water service delivery in Bangladesh. You can see in the last, in the left column, that local government division is the regulator, and it gives plan, strategy, and funding. In rural water supply, our local governments are very dominant in planning, site selection, beneficiary selection, cost sharing, and operation maintenance. Dphe, Department of Public Health Engineering, looks into the technical aspects. This is the SDG achievements of Bangladesh so far. The last row, you can see that rural water supply is 62%. You may find this different from the mix study of mix 2021, because mix is based on 2019 data. We have used the latest data, and we have some, the government has initiated some shelter programs where we are giving basic water and sanitation to ultra poor people. So this will certainly rise in next mix study. This is the legal framework Bangladesh Water Act says that right to potable water and water for hygiene and sanitation has been given the highest priority. Our national policy urges for involvement of local community and LGI in planning, installation, maintenance, and cost sharing. Also, emergency response during disasters. Our national strategy for water supply and sanitation stresses upon coverage, quality, arsenic mitigation, and climate resilience. We have a water safety framework as well. This map you can see, we have shown our climate vulnerable hotspots. The green, uh, these are in known as houses, wetlands basically. The yellow is the north, uh, the light green is our coastal belt where uh, Katrina has uh, shown some findings in her presentation, and the hills in brick red. These are our hotspots, and you can see in the brackets that what type of problem these areas are facing in terms of water supply. Uh, I mean, this slide is about a brief history of Dphe. Dphe started working in 1935 with tube wells and dug wells because we have very rich water table, which was pathogen free, and it was uh, less costly and easy to maintain these simple technologies. But when we have found arsenic and E. coli in some areas of our country, we are now turning to rural piped water system basically, and then in some areas PSF manage aquifer recharge and reverse osmosis, where chemical and bacterial contaminations can be contained and quality can be assured. Uh, you may ask that what we have done to our tube wells, which were installed long ago. In dealing arsenic, uh, we have installed ARP, arsenic removal plants, and AIRP, arsenic and iron removal plants, uh, uh, where necessary. We have put these things in our tube wells. Uh, bu- but here, sludge management is the problem. I mean, maintaining those tube wells and those plants are the small devices, but they are a problem. Uh, in dealing arsenic, we have installed pond sand filter and rainwater harvesting, deep tubewell in coastal areas, and rapid rural piped water system. Dug well, these things we have installed in various parts of Bangladesh. Dealing with E. coli, we have seen that best solution is if we can manage sanitation. That means safely manage sanitation. This will stop contaminating the water points. We have seen that the prevalence of E. coli is less if the uh, water point is at least 10 meters away from the latrine pit. And we have seen that the contaminations are mainly in dug wells. Uh, we are trying to stop using water from dug wells where necessary. Instead, we are going for surface water and rural pipe water. I fully agree with Katrina about the seasonal variability of water quality, and we need to monitor those things, the qualities of water all over Bangladesh, especially in climate vulnerable areas. For this, to make some policy decisions, we need data on four aspects, basically. Uh, uh, Expansion of water quality surveys in numbers and parameters. So far, our concentration was on arsenic and E. coli, but now we are seeing that our water contains manganese and salts as well. So we need data. Water quality monitoring in deep and shallow groundwater due to sea level rise, inundation, floods, drought. This is also very important, especially in our coastal areas and northern areas. Uh, Data on appropriate technology. In water stress areas, we are going for reverse osmosis. But this technology seems to be very expensive for our ultra poor people to afford. And research on a new service delivery system is very important. I mean, I would like to thank the REACH program and University of Oxford for doing this. I mean, for a research. I mean, a safe providing us with a safe pani model. I mean, we need research of this type in other areas also. I was thinking about way forward, and I have found Water Quality Thematic Report 2021, where Katrina is also a part. And I have seen that we have done many things. I mean, what has been described in that report for longitudinal and water quality monitoring. We have established 64 Dphe labs all over Bangladesh. We have a climate resilient WSP, hygiene at point of consumption or tubewell operator. We have done this in Bangladesh. We have a COVID strategy where we stressed upon this. Expanding water treatment is going on in Bangladesh. Focus on contaminated and underserved areas is our top priority. Water point regulation, we are thinking about this. And lastly, I think capacity building of the LGIs who are planning and maintaining the water system is very important to ensure water quality in all our water points, especially in climate vulnerable areas. And this is the end of my presentation. Thank you for hearing.
Thank you very much, Mr. Ibrahim, for that presentation on WASH service delivery in Bangladesh, where we looked a bit about the climate and water quality mitigation, as well as the advancing water safety within Bangladesh. The next presentation will be from WaterAid Nepal, and Kabindra Pudasaini, the technical lead of WaterAid in Nepal, will be giving that presentation. I would like to remind our participants that you can post your questions in the chat that is provided on the platform that we are using here. We will be monitoring that chat and we'll be answering some of those questions in the Q&A session. So remember to post your questions, please.
Hello. Good morning, good afternoon. I'm Kavindra from Nepal. Today, I'm going to share you about the climate resilience water safety plan in Nepal. Here is a map. This map is developed by the community people themselves during identify the hazard and mitigation measures.
Yeah, I think we seem to have a bit of a problem with the presentation there. We will try to bring it up in a minute. Meanwhile, we still have two presentations to go, and that's the WaterAid Nepal by Kabindra, and the next one will be from Michael Fisher.
Kazito, perhaps I can share my screen to see Michael's presentation.
All right. Yeah, let's try that and see if that works, and then we will work on Kabindra's presentation later. In that case, yeah. So Michael Fisher is an assistant professor at the Water Institute of the University of North Carolina.
And if I may, I think we just need to adjust the screen sharing settings to enable the host to share audio.
Yeah, we seems to have a problem with the audio.
Bear with me one moment while I try to fix the audio for this one.
Meanwhile, maybe it's a good chance for our participants to post questions at this moment for the two presentations that have already been. And we are happy to also receive any of your thoughts regarding some of the key priorities in climate resilient water safety planning. And hopefully if we have some time, we'll be able to discuss that.
I see Ellen is back with the Nepal presentation.
All right.
Hello. Good morning, good afternoon. I'm Kavindra from Nepal. Today, I'm going to share you about the climate resilience water safety plan in Nepal. Here is a map. This map is developed by the community people themselves during identify the hazard and mitigation measures to address this hazard issues. Nepal, after the new constitutions in 2015, delegating responsibilities of water supplies and sanitations to the local municipalities, local government. There is 460 rural municipalities, and in water resources there are a mountain in valley and terai. In mountains, the water is managed by the spring gravity flow systems, and following on valleys, there will be the dual water supply systems, groundwater and a spring. And terais, there is a groundwater shallow tubewell systems. For the management in mountains, water supply systems managed by users committees, water users committees. In valleys, there is public-private partnership, and government service provider, and the community people themselves. And in terai, government service providers and then communities. In rural water supplies, there are a lot of challenges. The main challenges are in the functionalities. There is a very less fully functional systems. There are 34% major repair, rehabilitation and reconstructions needed, and around 28% are in fully functional stage. Also, the water qualities is the big challenges. There is very less data and informations, and the water qualities in all the parameters like physical, chemical and biological parameters are the big issues. You can see one examples in terai. There is mostly problems in the manganese, iron, arsenic, and also like one example, one studies in 2020s testing of multiple resources. In a catchment valleys, and there was already across over the 90% total coliforms over the standards. And also the another big problems in the water resources as well. due to the source dry up, depletions, and in case of flooding problems in Tarai areas and landslide in mountain and hilly areas. And also, like a big challenge is due to the urbanizations and no water recharging, groundwater recharging, and groundwater is going to be depletions is another problem. And also the availability of the finance for the addressing of the climate is also the big challenges, and also challenges for the sustainability of the water users communities in the rural water supply setting systems. So for this, addressing the water qualities issues, government has introduced the water safety plans since 2006 for the risk assessments and for improving the management approach. So for implementing the water safety plan, Department of the Water Supplies and Sewerage is taking the leading role with support from the users committees and the municipalities, province government, and the surveillance units of the WSPs by the Department of the Health to follow the 7 steps of the WSP. After just addressing the issues of the climate variations, the government has also developed the guidelines of the CRWSP approach under to address the issues of these 5 issues, key issues, like conservations and protections of the water sources, diversifications of the water supply, preparations of the extreme weather events, resilience to the water quality variables, and water conservations. There are some good success after the implementations of the water safety plans and also the challenges. In case of the success, already there is 4,000 communities has been implementing the water safety plans with the support of Department of the Water Supplies, WHOs, UNICEF, and other NGOs. Already after implementing the WSP steps, the community users committees has been addressing the treatment plant and providing provisions of the laboratories, and users committees are already much aware about the WSP's requirement, and also starting to the like a BCA, vulnerability assessment surveys during the construction stage of the water supply schemes. Still, there are a lot of challenges as well due to the limitations of the scale to the new government from the both local governments and then province government. In the rural communities, there are not sufficient water users members for implementations of the WSP steps, and still there is unclear responsibilities for financing on the WSP's approach, and overall water supplies financing gap is there. There are still for betterment of the water safety plans, government has to be just thinking about the further steps on the WSPs for scale of and strengthening of the number, increasing the number of the water safety plan implementations. Only the less than 5% are implemented the CRWSPs these days, and also require of motivations factors and incentives for the WSP teams because they are been providing voluntarily, and also to need to be increase the data of the water quality, testing parameters, testing like availabilities of the testing kits is required in the water supply system, and also need to be strengthening the CRWC surveillance units under the Department of Health, and local government has to be also to do the regular impact assessment, and also need to be focused on quality and then quantity, and also required for the increasing of the investments on the WSPs for making a sustainable WSP steps. So at the end, I would like to mention about CRWSP is not everything, but it is a backbone to make a worse resilience. Thank you very much.
Thank you, Kabindra, for that presentation on the climate resilient water safety planning in Nepal. We'll now go to our final presentation by Michael Fisher. He's an assistant professor at the Water Institute. Welcome, Michael.
Hi, I'm Mike Fisher with the Water Institute at UNC, and I'd like to share two brief case studies related to the overall topic of surfacing water safety issues with an emphasis on resilience in contexts of water systems and water safety and under-recognized chemical and microbial hazards. The first case study looks at accounting for rainfall in monitoring microbial safety and identifying vulnerabilities in systems that may be exacerbated by extreme weather events related to global warming and other changes. The second case study looks at toxic metal contamination associated with water system parts and opportunities for prevention. This is based on work conducted by the Water Institute in partnership with stakeholders over the last several years. And the first case study looks at a sample of over 1,200 hand pumps across 3 countries, Burkina Faso, Ghana, and Ethiopia. And data were collected from these water systems at field level over multiple years, looking at functionality, microbial water quality based on field-based water quality tests, as well as sanitary inspections, identifying characteristics, sources of contamination, such as latrines and garbage dumps, as well as deficiencies potentially in protective barrier measures, for example, cracks or erosion that may reduce the effectiveness, for example, of concrete slabs, walls, and other structures at preventing intrusion of microbial contamination in surface runoff, and linking this with global rainfall data sets to understand associations between microbial water quality, seasonality, rainfall, and different dimensions of sanitary inspections. Now, previous work on sanitary inspections has suggested that these can be useful in understanding vulnerabilities of water systems, and that we can disaggregate sanitary inspection scores to understand terms that relate to barriers such as the walls, slabs, and aprons and other items we discussed, sources of contamination such as proximity to latrines, waste dumps, feces, and other sources of fecal and microbial contamination, as well as carrier terms such as stagnant water, surface runoff, and other carriers that can wash microbial contamination into water systems. In addition, there's ample evidence that precipitation and seasonality are associated with microbial water safety, and that these are important dimensions in understanding microbial water quality. However, it's often challenging to get high-quality monitoring data, as field work can be more difficult during extreme weather events, particularly for remote systems where roads may be difficult to traverse during rainy seasons and extreme weather events. As a result, monitoring can miss the rainiest days and may tend to miss important indicators of vulnerability, microbial risk, and contamination, and lead to underestimates and or errors in targeting systems that might benefit the most from preventive and corrective measures, particularly in the context of climate change that may exacerbate some of these issues. And what we see across this 3-country data set, when we look at precipitation broken into quintiles and the barrier component of sanitary inspection scores also broken into quintiles, when we look at the lowest rainfall quintile and the sanitary inspection scores corresponding to the lowest barrier deficiency and the lowest risk level, we see the vast majority of water samples in this lowest WHO risk category, corresponding to no detectable E. coli colony forming units in 100 mils, and very relatively many fewer samples in the low, intermediate, and high risk categories, corresponding to 1 to 10, 10 to 100, or over 100 E. coli CFU per 100 mL. Similarly, when we look at high precipitation but low sanitary inspection barrier risk, or low precipitation, high sanitary inspection barrier score risk, we see an increase in the proportion of samples in this second risk category, but not too dramatic. By contrast, when we look at water quality samples from systems with the highest barrier score deficiency risk and the highest precipitation levels, we see much higher prevalence of water samples in the highest WHO risk category and many fewer samples in conformity. Similarly, if we look at our borehole with hand pump data by sanitary inspection barrier score on the x-axis and log precipitation in millimeters on the y-axis, we see a trend towards large regions of high-risk samples associated with those systems with both high barrier risk and high log precipitation. And this suggests again that as we see increases in extreme weather events associated with global warming and other changing patterns, we may expect to see more microbial contamination and more severe contamination events in the most vulnerable water systems. Furthermore, there may be compounding if extreme weather events and extreme diurnal temperature fluctuations contribute, for example, to erosion, cracking of concrete, or other forms of weathering that may lead to a greater propensity of systems to have barrier deficits that put them in this higher risk category. So again, we see an opportunity to monitor and do prevention to avoid increasing likelihood of high risk events for the systems most in need of maintenance and repair during extreme weather events. Another form of potential opportunity for prevention is something we saw from a study of 261 water systems across 3 countries in Ghana, Mali, and Niger. We looked at data collected over 2 years, looking at water quality samples from systems with metal components after 1 hour of stagnation, analyzed by ICP-MS or OES, mass spec or optical emission spectroscopy. And what we found, previous work suggests that toxic metal contamination may occur in water systems across global settings, particularly where water system components with lead or other toxic metals are in contact with water. But this can often be missed if water quality regulatory monitoring is done before the metal components and water systems hardware are installed. In addition, in some cases, laboratory capacity may be limited for detecting toxic metals at concentrations of health concern. What we saw across our 261 systems, the vast majority of systems were in conformity with WHO guideline values for most toxic metals studied in the majority of samples, but across all 3 countries, about 9% of samples exceeded the WHO guideline values for lead in drinking water. And this was robust across system type, age, country, and implementer. Furthermore, in 82% of systems, we found that at least 1 part exceeded the 0.25% lead by weight that's recommended for drinking water systems. And in the case of brass components, half or more of systems actually exceeded this by quite a bit, over 8% lead by mass, suggesting that unsuitable metal components in general and unsuitable brass components in particular might be important sources of lead in water systems. Both the chemical and microbial hazards that we identified are ones that can easily be missed if monitoring timing and methods aren't designed to capture them. And where they're effectively monitored and detected, there's opportunities for prevention, targeting, monitoring, detection, prevention, and remediation in concert with water safety plan approach or other similar iterative approaches that rely on water quality monitoring to detect these hazards and enable implementers, users, and regulators to do effective prevention. There may also be important opportunities to strengthen monitoring analysis and data management to support efforts for resilience in response to these and other under-recognized hazards in order to improve the ability of systems to deliver water that's safe from chemical and microbial contaminants, even in the face of anticipated shifts in environment, climate, population, and improvements in service levels as countries make progress on the SDGs and SDG 6 in particular. And with that, I'd like to open it up to questions. Thanks very much.
Thank you very much, Mike, for that. Those 2 case studies from West Africa looking at accounting for rainfall in water quality as well as toxic metal contamination. And of course, to the other presenters who gave us presentations from Bangladesh and Nepal. Before we move to the Q&A session, we'll have a short session here where we would like to hear from our participants. And we are going to the Mentimeter platform. If you can see the slide on the screen, there's also a link that's posted in the chat box. And so you can click on it to go to the Mentimeter. You can go directly to the Mentimeter, www.menti.com, and then enter the code 3356 3442. And you'll find questions there. We would like to hear from you what you think, based on your context, some of the priorities that need to be addressed to increase risks to rural water supply quality. I think we will be monitoring those results live, and we will see as all of us vote on what we think are the priorities. I think in a minute that screen will be shared. I hope you've all been able to log in, www.menti.com, and then you enter the code 3356 3442. In a minute, we'll see the screen come up. Yeah. And you can use the QR code as well. Yes, so as we can see, there's the ranking in order of priority in your context, following what needs to be addressed to increase risks to rural water supply quality. We can see most people think that risk-based monitoring is important. And that has now been overtaken with a responsibility, whereby we need to clarify the responsibility for water quality monitoring and response action. So the first three areas: responsibility, risk-based monitoring, accountability. That is keeps changing as we vote. And of course, we have training, accountability, intervention, and equipment. So we will give another 1 minute for the votes, and then we will close this session. There's 7 different priorities there. Just a few seconds to go, and then we'll close that. Yeah, and so we will close that. And the first, of course, is risk-based monitoring according to the majority of the participants. The second question is pick 2 areas where we want to see a stronger regulatory role in rural low-income countries. There's 3 options: supporting water quality data analysis, providing technical guidance and support to service delivery, and then enforcing water quality standards. We'll give another 1 minute for all of us to get the opportunity to vote. Yeah, so we can see most participants think that providing technical guidance and support to service providers is as an area that they think the regulators need to come in strongly, especially in low-income countries. Thank you for that. We will discuss a little bit about that in the Q&A, and maybe the first thing I will ask is for all our presenters to put on their videos, and then we will move on to the Q&A session. Thank you very much. And maybe just a quick question regarding what you've seen on Mentimeter. And maybe this question is, I'll randomly select. Mike, what do you think about those responses that you've seen? Do you think they actually reflect what you might see on the ground and what you've observed, for example, in West Africa when you were working there?
That's a wonderful question, and I think the other participants may have more to say. But in terms of the Mentimeter responses, it was really interesting. I actually took screenshots of these to reflect on them further. But it was really interesting to see the agreement around the importance of clarifying responsibilities for water quality monitoring, obtaining high quality data, and building capacity around collecting and using high quality data for improvement. That was really striking to me. I guess I don't know if I'm qualified to say whether it reflects sentiments across many different contexts, but it certainly resonated with me around hearing experience of many different implementers and communities who are hungry to be empowered to do these things effectively and translate them into action.
Mm-hmm. Yeah, thank you, Mike. And the next question, maybe I'll direct this to Katrina, because of course, both of you are from academia and you deal a lot with data. There's a question from Fusi about how the data can be used to support communities in making decisions. So how the increasing data can be transferred into decisions at the community level, because we all agree we might be able to capture all this data, but then how is it actually used?
Thanks, Casito. Yeah, I think that's a really important question, is how this data is used, how it goes to make change. And that's something we've been working on in Kenya. I've been working with Saskia Nowitzki, who's on this call as well. And she's been looking at particularly how people use that data, because it's not enough just to generate the data. We need people to take it and make different decisions that are going to improve water safety. And that's really challenging if you're getting water quality results like Mike's been presenting, where you're finding contaminants that people weren't looking for before, especially, and people don't know what to do with that data. But it's also quite challenging, even if it's just E. coli saying that water's not safe, what do people do next? And I think while I don't have a simple answer for you at all, but I think there's two things we need to think about. One, certainly transparency. I think people have a right to have access to this data. They should know what's in the water quality so that they can think about that more. But also, who is the right person to give that data to make sure they have it so they're going to act? And certainly from Saskia and my work in Kenya, what we see is that while the household may be interested in that data, they're not going to act on it. They don't have necessarily the capacity to act on it. But if you can find someone who's a water manager, if you have someone who's got some professional responsibility, they're the people who can take that data and act on it and access the resources to make that change. And so that's one where we've seen the advantage of, for example, professionalizing service delivery, so that you have someone who has that responsibility to take that data and to action it.
Yeah, thank you very much, Katrina. I think it's something that we've all observed in many places. Of course, that ties in a little bit with the roles and responsibilities, because in many countries, for example, utilities will tell you that's not part of their responsibility, for example, more collecting, especially like data on a large scale, especially in the catchment area. Maybe their mandate doesn't extend that far, and there's probably another authority that is supposed to be doing that. And maybe at this point, I'll move on to Mr. Ibrahim, who is in government. Mr. Ibrahim, have you found this data to be useful to you? What, for example, are you doing within government in your local context to actually get this data, and how can it be properly packaged, or how can the institutions be properly framed in a way that they are able to actually get this data, handle it, and it can be used for decision making?
Thank you. Thank you for the question. What we observed in Bangladesh is that our government is spending a lot of money in WASH programs and a lot of money in climate change resilience programs. But there is a gap in coordination between two services. I mean, we are spending on WASH and we are spending for climate, but we are not spending for WASH services, which is climate resilient. I mean, these data are very important for as policymakers to us, those who work in local government division and responsible for WASH services, and also for those people who are working with climate and climate change and climate resilience. So these data, I mean, are very relevant to policymakers, and if they can use it in a proper manner, data can change the pattern of our spending, and I mean, we can bring out very successful projects through use of those data. Thank you.
Okay, thank you, Ibrahim. And of course, Kabindra, you work in WaterAid, Nepal, and I'm sure you work with a lot of stakeholders. Of course, there's many stakeholders involved in issues of climate resilience, water safety planning. What do you think, or how can collective action, in your opinion, support accelerating response to these challenges that we have seen?
Thank you, Nketijo. It is a very nice questions about making a sustainabilities of the CRWSP. I echo with Mohammed, especially in case of like a both, in case of rural setting, people, they are not much aware about, the water qualities. So the local government firstly has to be give a higher priority for implementations of the water safety plan, addressing the issue of the CRWSP. That's way is a two-way. One is need to be more communicate, more like a training for that community people to implement the CRWSP approach. And similarly, the three tier of government, in case of Nepal example, we have a federal, province, and local governments. They also has to be give a higher priorities for making a sustainable CRWSP approach. So from the WaterAid side also, we have to be work with all the development partner closely, and has to be implement the the sustainable approach of the CRWSP. That is the the ideas for making a sustainable CRWSP especially in the rural communities. Yeah.
Okay, great. Thank you for that answer. Definitely many stakeholders involved. Unfortunately, that's all the time that we have. Of course, these sessions are always, they end up being very short, but we can continue with the discussion on the chat. And of course, the recording of this session will still be available. And so at this juncture, I'm going to hand over to Virginia from WaterAid Sweden to tell us the next steps in terms of the call for action. Virginia, please.
Thank you so much, Kazito. Thank you. Ellen, if you could flash the slide of the calls to action, that would be great. So today we've heard lots of different experiences and seen in various ways the correlation between weather and water quality. We've seen the problem of data gaps, high rates of contamination, but we've also heard about steps to address these problems through, for example, vulnerability assessments. We would love to continue this conversation with you to capture insights and keep on learning. So just before we close, we want to reiterate the calls for actions from this session and invite you to continue exploring them. So to remind you, our calls to action are around ensuring risk-based monitoring, mainstreaming climate resilience measures in water safety planning at all scales, and clarifying roles and responsibilities around who should act and how they should act on water safety evidence. To take this work further, please do reach out to the session organisers, WaterAid, Oxford and UNC, with feedback on the calls to action or to share further cases and lessons. There is a sign up for future collaborations, which we're going to put in the chat. And we're also going to share with you the option of joining a rural water supply network discussion on the topic. So perhaps, Michael, I could ask you to put that one in the chat as well. And in the files section on this site, we have put in some new publications and resources that you might find useful. So from Oxford, we have the latest findings of the REACH programme on water and climate. From WaterAid, we have a new publication on our programme and policy work on water quality. And from UNC and Michael, we have a recent paper on sanitary inspection, water quality analysis, and water safety in hand pumps in rural sub-Saharan Africa. Thank you ever so much, everybody, for joining the session. Thank you so much to our moderator, Kizito, the panelists, and for Ellen Greggio behind the scenes for all of our efforts in bringing this together. It's been fantastic to see you all here. Thank you.
Thank you.
Thank you. Bye-bye.
Thank you.
Thanks very much.
Thank you.